So one of the areas that we like to treat here at Carolina's Pain Center is the shoulder. The shoulder is a fascinating joint. It's a complicated joint.
Inside the shoulder, the bones are held together similar to a golf ball sitting on a tee. The head of the humerus is the ball, and the cup-like glenoid is the golf tee. The edge of the tee is a rubbery ring called the labrum that adds extra support to the joint.
Which many of us are familiar with ball and socket, perhaps with our hip joint. But that's a very deep socket, which is very secure and stable, but it also limits how much we can move. Because the shoulder is shallow, it provides greater range of motion.
The shoulder is held securely in place by the ligaments, capsule, and muscles that surround the joint. Whenever these structures are weak or injured, shoulder instability and dislocation can occur.
Unfortunately, it requires a lot of supporting structures, ligaments, tendons, muscles, and that's why we have so many more problems with the shoulder. It's more apt to getting injured. But that's okay because we can help take care of that with a few simple procedures, hopefully. Let me tell you a little bit about what we see and how we can treat it. Some of the more common things that we see here, things like rotator cuff issues. Many people have heard of the rotator cuff. This is actually a combination of four muscles that help hold that shoulder into the joint. Primarily the supraspinatus is the larger one that can end up having some rotator cuff tears that can be treated. These tears can happen acutely. If we're taking a walk with your dog and all of a sudden it sees a squirrel and it pulls on your shoulder, right? Or it can happen prolonged over time. A lot of repetitive overuse activities like throwing injuries, stuff like that. Rotator cuff is a big source of pain. Alternatively, the joint itself, what we call the glenohumeral joint, is a site where we can get arthritis over time, and also other conditions such as something called a frozen shoulder.
Frozen shoulder is a common cause of shoulder pain and stiffness. About 8% of men and 10% of women of working age are affected by this disabling condition. They may struggle with basic daily activities. It can also cause sleep disturbance. The exact cause remains unknown. Current treatments aim to relieve the symptoms.
Which is something that happens. There's really not, we don't understand why it does, but you lose range of motion for 6 months to a year before it resolves on its own, which can be quite challenging to treat sometimes, but we have some ways to help get through that timeline. And then another site you can get arthritis is in the AC joint, which is where your clavicle attaches to the end of the shoulder here. And that can be especially difficult to deal with. A lot of reaching across type of activities can irritate that arthritic joint there. So how do we figure out what's going on with the shoulder when you come to see us? Well, we'll sit down, we'll have a conversation, we'll go through your history to see if there was an acute injury, or is this something that's kind of been growing over time and causing a lot of problems. If you've had any other treatment in the past, we'll look at any other imaging, maybe some x-rays, maybe an MRI, along with a physical exam. And that's really going to give us a lot of information. We're going to check your range of motion to see, can you bring your arm up above your head or behind your back, checking different muscles. We're going to see if it's what activities throughout the day. Is it difficult just doing dishes or something in front of you, or is this activities where you're reaching above you? Once we get all that information, we can figure out what the treatment options are going to be for you. For the shoulder, in general, when we look at parts of the body we're trying to treat, what we really try to do is break down, we want to treat the pain, we want to improve stability and functionality, and then we want to help you increase your activity and exercise. So the pain component we're going to address with certainly, there's some medications that can be used, over-the-counter medications, anti-inflammatories can certainly be helpful in the short term. We can also use physical therapy, can really do a good job for us. Physical therapy is an important part of your treatment because they will help with that stability and that functionality. But sometimes we need to help decrease the pain before you can get to really work with the physical therapist. So we'll look at some procedural-based therapies and injections. If we're trying to target the rotator cuff or the bursa, called the subacromial bursa, that lies over top of that rotator cuff, we'll do an ultrasound-guided injection using some cortisone in that area, and that can reduce the inflammation and pain that you have in that rotator cuff. We can also use steroid-based injections with ultrasound guidance, treating the glenohumeral joint, the shallow ball and socket, and also the arthritic AC joint that we have as well. Steroids are a good first option. It's not the only option though. We can look at using non-steroidal options, such as there's an herbal supplement called Tremel and Zeal, which can be quite helpful for people that can't or don't want to have steroids. One way to address chronic inflammation is to utilize regenerative therapies such as PRP. PRP is your own blood cells that we pull blood out of your body, we spin it down, and we extract the platelets, which is the part of the blood that has the growth factors and all the regenerative properties that we want. So instead of causing an injury to initiate regeneration, we can actually skip the injury and just give you the benefit of the regenerative properties by using your body's own platelets, which means you're not going to have any allergic reaction because it's coming from your own body. We spin it down, we inject the platelets and the growth factors around the area of injury. So for instance, a rotator cuff injury, this initiates signaling cells throughout the body to say, hey, come here, I have a problem here, I need some help fixing it. And this is what we look for with regenerative therapies, particularly PRP.